Hi, and welcome to the Health and Wellness in Bayonne show. I'm Dr. Mike Acanfora, and I am your host. Thanks so much for joining us today. I am honored to have as our first guest my friend and partner, Dr. Koyer. Hey, Dr. Noah, how are you?
Hey, Dr. Mike. Thanks for having me today. I'm really excited to be on the show.
Awesome. So today we're going to talk about the SHINE program, which you and I do together, and we've had the fortune to be mentored by one of the premier psychiatrists in the country that does this, Dr. Ned Hallowell in New York City. Can you tell everybody a little bit first about yourself and how you got into chiropractic, and then go into Dr. Hallowell and the SHINE program?
Okay. When I was about 12 years old, my mother was sitting and watching me play baseball, and she was complaining about her low back. And just so happened someone next to her was a chiropractic CA. And she said, "Why don't you go see my chiropractor?" So she did, and she got told maybe a little different story about chiropractic than most people would be used to hearing. Not that it's about low back pain, not that it's about car accidents, but it's about maximizing your health and potential. And that really resonated with my mother, and thank God she brought me, my sister, my brother, my father in. And I can remember laying down, getting my first adjustment, getting off the table and walking down the hallway that I've walked down 10,000 times since, and looking at my mother and saying, that's what I'm going to do for the rest of my life. And what I found even greater or cooler, and it took a little while for me to realize it, but that prior to that I suffered from strep throat, ear infections, chronic infections, and after that first adjustment I've never had them again. And now we're going on close to 30 years of not having those issues.
That's amazing.
Yeah.
And very few, like you say, very few people know that chiropractic basically doesn't treat the disease or the problem, but really looks to correct the spinal imbalances or misalignments in the spine, and health then becomes, what we'd say, evident. It goes through you and out. It
was certainly, in my case, and certainly in thousands of our patients' cases as well.
Sure.
In terms of the SHINE program, SHINE stands for Special Help Integrating Neurologic Experience.
Okay.
So our two friends, our dear friends, Dr. Ned Hallowell and Dr. Pat Tempo, met about 5 years ago at something called the Meeting of the Titans at MIT. And they shared each one of their own experiences, Dr. Tempo being a chiropractor and a wellness leader, and Dr. Ned Hallowell being the world leader in ADD and ADHD, put their two combined information, knowledge, and expertise together and came up with this program and introduced it about 2.5 years ago. And when we were sitting in the room and we got introduced to it, both you and I immediately signed on, and we were one of the first 2 chiropractors in the country to be certified as SHINE practitioners.
So tell everybody what ADD and ADHD, what is that exactly?
ADD and ADHD is attention deficit disorder or attention deficit hyperactive disorder. It's more commonly seen in boys. It's distractibility, hyperactivity, and impulsivity, which is the triad of that. Many people call it a disease, but the program, SHINE, and we don't look at it as a disease. We look at it as a trait that these children, boys and girls, and adults have. And that's what makes the program, at its base foundation, different than any other program out there.
Sure. And you and I laugh about this when we do lectures together, how basically that triad that you were talking about, which is what again?
Hyperactivity, distractibility, and impulsivity.
And impulsivity. I mean, that describes every child that I know. It describes my son Jack to the T.
And my son as well.
And Jack and Hayden are very stereotypical boys. And so what is the normal course for a child at this point with ADD, ADHD, if they've never heard of SHINE? What normally happens to these kids?
If there's a child out there that has these symptoms or these traits or this disease that they call, generally they go to their pediatrician, might go to a childhood neurologist, maybe some counseling. But unfortunately, the first or the very quick course of action is some sort of medication or drug that suppresses their symptoms, but also suppresses who they are, their special sauce.
Sure.
And the SHINE program wants to not suppress these special traits, not take away the special sauce, but to allow them to shine and to be the best of who they are at all times and in anything they do.
So in looking at people in history, are there certain folks that come to mind that you would say would have been classified with ADD or ADHD or were classified with ADD, ADHD?
Oh, sure. When we do the lectures in the office, we have this great picture that you've come up with, and it has all people that have had ADD. And some of them that come to mind is Leonardo da Vinci, who was maybe the most brilliant man who ever lived.
Sure.
People like Bill Cosby, Robin Williams, and I don't think we know that he has ADD or ADHD or both.
Right.
Many of the presidents, actors.
It was Albert Einstein, who didn't speak until he was 4 and didn't write until he was 7. So there's quite a few folks that when you look at the scope of history that would fall within the parameters of what is called ADD, ADHD.
Absolutely.
So tell me a little bit about SHINE itself. Like, what makes this SHINE program and how it came about with Dr. Gentempo and Dr. Hollowell?
Okay, so the thing that makes it most different is the chiropractic portion.
Okay.
Like I said right from the beginning, most people don't look at chiropractic, unfortunately, as something that is for your health and wellness, paramount for your health and wellness. And that's what the foundation is and makes it so different. Because there are a ton of natural alternative approaches out there. One is called the GAPS diet, which focuses on diet very, very, very intently. Other ones look at balancing the brain through exercises, specific exercises that balance the right side of the brain with the left side of the brain, that balance the right side of the brain with the back side of the brain with the front side of the brain.
Yes.
But no program that I'm aware of does and looks at specific neurological exercises that does what I just said, balance the brain.
Sure.
And some of them could be as simple as using a balance ball or a wobble board or standing on one leg. So it incorporates that. It incorporates specific nutrition, two specific nutrition ideas that I could think of. One is a specific diet that's casein and gluten-free. Now, for those of you who don't know what casein or gluten is a very allergic protein in milk, and gluten is one of the proteins in wheat. And those are two of the most allergenic and aggravating substances in our food today, and seems to really aggravate children and adults who have ADD, their symptoms.
Sure.
So we eliminate those.
Yep.
And then we give them a diet, or we suggest a diet or a paleo diet or an ancestral diet that focuses on meat, fish, vegetables, nuts, seeds, and eggs.
Yes.
And then we add a few select specific supplements, not a whole handful of pills, but we ask them to take fish oil on a regular basis, and a very specific type of fish oil, because fish oil is one of the few supplements you don't want to buy anywhere but a very reputable source.
Sure.
We give them vitamin D3, which we know we're all deficient in.
Sure.
And in probiotics, which is the healthy gut bacteria that keeps our digestion moving, it keeps our immune system high, keeps our bowels functioning, and it keeps a happy stomach. And we know now through neurology, the healthier your stomach is, the healthier your gut is, the healthier your brain is going to be.
Absolutely.
And then the third component is chiropractic. If these children are subluxated or their spine is misaligned in specific areas, their body's not moving right and they're not getting the right information from their spine, their brain isn't going to function right. So it's a triad of chiropractic, nutrition, and specific exercises.
Excellent. Let's talk about Dr. Hollowell for a second. He's a Harvard-trained psychiatrist. He is considered by many to be the foremost authority on ADD and ADHD. And when he met Dr. Cintempo, what did he say to Dr. Cintempo after he heard Dr. Cintempo speak?
He pretty much said, first he said, I'm a hugger. And Dr. Cintempo said, well, don't worry about it. We as chiropractors are huggers too. And they gave each other a big embrace, and they quickly became great friends. But I think they looked at each other as kindred spirits. And I know Dr. Hollowell is a world leader in the world leader in ADD, ADHD, but he was looking for a comprehensive, non-medication, wellness-based approach to treating or taking care of ADD and ADHD.
Absolutely.
And that's what chiropractic and that's what Dr. Cintempo had to offer.
That's awesome. And very few people have heard that story, which is remarkable. What is it that Dr. Hollowell said about the brakes in the car?
He describes ADD, ADHD like this, and he would know, for one, he has ADD, ADHD. His two children have ADD, ADHD, and he's written 18 books amongst many other things. So he would know, but he describes it as having a Ferrari brain with bicycle brakes. So we all know what a Ferrari is. It's one of the fastest cars, but bicycle brakes. So so a child who has ADD or an adult who has ADD or ADHD, their brain is always thinking, always revving too fast. They're thinking about what they're going to eat for breakfast, what they have to do for homework, when are they going to play with their friends, and when is soccer practice. All at one time.
Correct.
And the other way he explains it too is if you're driving in your car and you ride over a puddle and all the mud splashes on your windshield, and then a windshield wiper comes through and it leaves a black dirty film. And that's another, sometimes when we get some of these ADD or ADHD people come into our office, they view the world as a little bit foggy or slightly a little bit unclear.
Sure.
And those are the two ways he explains ADD and ADHD.
Excellent. I mean, that's just remarkable explanation for that. So let's dive a little deeper into the nutrition part of it. You and I both had the same nutrition teacher down in chiropractic school, and back then we kind of laughed at him when they showed that video of the children that were on the Oprah show drinking milk, and then how they responded shortly thereafter was almost like they were possessed. It was horrifying. And then they took the children off of the milk and showed them later on. And tell people about this. Like, what is it that transpires with the dairy, and then go into the gluten aspect of it, and what is gluten, and what foods contain gluten?
So we know that there are some very highly allergenic foods. Some is corn, tomatoes, potatoes, soy, but likely the two most allergenic foods. Allergenic meaning that if you ingest it, it causes some sort of response that's not normal, like hyperactivity, or constipation, or brain fog, those types of things. And the two, like we said, is dairy. And gluten or wheat. Now, dairy has a lot of different proteins in it. The two proteins in dairy are whey, which is very non-allergenic and very beneficial in many ways, and casein. Casein is very allergenic. So like you said, if somebody who has a dairy allergy ingests it, they're going to have symptomatology that's not normal. And one of the reasons why dairy is so allergenic is that it's, whether you may not know or think it, being a consumer, going to the supermarket and buying a carton of milk, it's highly processed. It's taken from the cows, it's filtered, it's heated to 180 degrees. Then it's spun super fast to homogenize it to get the product that we have today. Now, if you were able to get milk that wasn't homogenized and not pasteurized from grass-fed organic cows, most people can tolerate that, and it's a supreme source of nutrition. But in New Jersey, it's impossible to get. Same thing goes with gluten. About 30 years ago or so, they genetically modified wheat and put more gluten into wheat. So wheat is flour, basically. and to make it more sticky, like think of a pizza dough, and you're
Sure.
stretching it and flipping it and twisting it. Gluten gives it, gluten like glue, glutinous, gives it that stretchability.
Okay.
Well, that protein is also very, very allergenic, and it irritates the stomach, and it irritates the gut. And it's becoming more allergenic because it's becoming more genetically modified, and it's in everything. In what processed food do we not have wheat in?
Right.
And then to take it one step further, all of our cosmetics has gluten or wheat in it. And it's just,
Sure.
and we become allergic to things as a society when we are constantly exposed to it.
Sure.
And we are constantly exposed to wheat and gluten. And like we talked about a little bit, the stomach is so important. The gut is so important. Your digestive system is so important. And when you eat those things, it irritates that system.
Sure.
And we all think that our brain has the most neurons or the most nerve cells in the nervous system, the system that controls your whole body, and that's what we all think. There's just as many cells of nerve cells in your stomach, and in that gut area, and in your intestines. So if you're constantly irritating that area, it becomes inflamed, and we now know that almost all disease processes start with inflammation.
Absolutely.
And as your stomach becomes inflamed, and it's inflamed every day, over and over again, it inflames the brain.
Yes.
And when the brain, and we're not talking about super high fever inflamed, but just causing a difference that causes an adverse symptom or problem like ADD and ADHD.
Sure. And for those, even those that don't have ADD and ADHD, the way in which, the lens in which they view the world after being exposed to gluten becomes problematic, and the expression of life, what we talk about in the office. So it really does become a bigger problem. Let's dive into the nutrition and the supplements, because I think that's really important, especially in the studies that are coming out that we've seen on the fish oil and probiotic and vitamin D. Let's talk about our baby vitamin D for a second.
Okay. So we all produce vitamin D through sun exposure. Mm-hmm. But because of where we live, and because we're almost always clothed, we don't spend enough time throughout the year to generate enough vitamin D. So vitamin D, sun hits your skin, it's created in the skin, and it's absorbed back in the skin.
Right.
And that's the best way to get vitamin D.
Okay.
It doesn't happen enough here. But vitamin D is not a vitamin at all. It's a hormone that regulates over 300 genetic expressions.
Sure.
Along with immunity, it's also anti-inflammatory. So proper vitamin D levels are really, really important.
Sure.
Keeps the brain healthy, allows your immune system to function. So that's one of the prime supplements we suggest to nearly all our patients, but definitely for our Shine patients too. And the great thing about vitamin D is it's one of the cheapest supplements on the market.
Yep.
And the take home for vitamin D is, and the important thing is there's two types of vitamin D. Mm-hmm. There's D3 and D2. Okay. D2 is synthetic. It's not, it's made in a lab. It's what your medical doctor will give you if they try to boost your immune system, boost your vitamin D levels up, and it's not natural. Okay. Vitamin D3 is much more active, much more bioavailable, and it's the form that's closest to what we get from the sun.
Sure.
And it's one of the biggies, and it's really, really important. And when we look at levels, if you ever get your blood work done, you're going to get a list, a range. You want from 30 to 100.
Sure.
Well, 30 being the low end of normal, 100 being on the high end of normal. You want to be at least in that 60 range.
Sure.
And that varies from person to person, and we can't give you an exact number of how much you should take.
Right.
But that's the level where you want to be if you ever get your blood work checked.
Sure.
And that's really important.
So we can go out in the middle of the winter, do some sunbathing, and we're going to get our vitamin D?
No. No, not. The sun has to be at a specific angle at a specific time.
Okay.
Once it's above 60 degrees and you could see your shadow, then you can get vitamin D. Likely the best time of year is early springtime when it's about 60.
Okay.
Not many people want to be in their bathing suits when it's 60 degrees.
But that's fascinating, because then what you're saying is that for, 5 months out of the year, we don't have enough the angle of the sun isn't great enough to produce vitamin D on our skin? Is that what you're saying?
Yes, it's the fancy scientific term is the sun's azimuth. I believe that's how you pronounce it. But it's right. It's probably more like 6 months out of the year. It's probably from October to March, April.
Sure.
March, April.
Wow. So we often see in the office people with vitamin D levels down around 12 or 20. The normal low should at least be, you said it was 30, correct?
Right.
With the ADD, ADHD children that we see, their levels are, again, we're finding are in the 20s, which
it's just horrifically low.
Horrifically low. Yes. Let's talk a little bit about one of your favorite things to talk about, which is probiotics.
Okay, so probiotics means pro is for life, biotic is life.
Sure.
We have about 70 trillion cells in our body.
Okay.
We have 10 times that many organisms, bacteria, virus, fungus, other things that live in our stomach.
Sure.
They create specific vitamins for us. They keep our immune system very high. They keep our bowels working, and a whole host of things that we don't even know yet. In fact, this is the big new medical realm for sure, or health and wellness realm, is what's going on in our guts and stomachs. But probiotics help supply and to increase that good bacteria in your stomach. And to feed the bacteria that's already there, so you have a high number of beneficial bacteria in your stomach and a low number of opportunistic, like parasites and specific viruses. But the benefit of having a high quality probiotic is incredible, and it's so important. It's one of the foundations of health. You should take a great supplement, but then you should also, which is a whole topic in and of itself, you should also eat a lot of cultured foods, like natural sauerkraut and natural pickles and kimchi and kombucha and water kefir, even some yogurts, very specific yogurts, will help you foster a better and more beneficial gut bacteria and flora.
Sure, and that is one of the things that one of the topics we'd like to have you back on for, is to talk about your experience with cultured food, and you do a cultured food class.
Yes.
But it's very similar to what you're saying about vitamin D. The best way to get your D is to be out in the sun.
Right.
The best way to get your probiotic, it seems to be, is through a cultured food.
Absolutely.
Whether it's sauerkraut or pickles or any of those things that you just said. Let's talk a little bit about fish oil and what that does for the brain and for the body and for the child with ADD, ADHD.
So let me bring that home in a real easy way, Dr. Mike. What is your brain mostly made out of?
Fat.
Exactly. So your brain is made up about 60 to 70% of a specific fat called DHA.
Okay.
That's half of what fish oil is. So fish oil, or omega-3s, there's 3 omega-3s, but fish oil is primarily DHA, which is what our brain is made out of, and EPA, which reduces inflammation.
Sure.
So all of our bodies are inflamed, or most of our bodies are inflamed just from where we live and how we eat. Fish oil squelches the fire. Omega-3s squelch the fire. So you need to get high quality fish oil on a regular basis. High DHA, high EPA. There's the third omega-3 is ALA, that's found in plants, and it's very beneficial. It's very helpful. It's very good to consume, but it is not as bioactive for our bodies. It doesn't work in conjunction with our bodies as nicely as EPA and DHA does.
Fascinating. There's a couple studies out that were done in Britain with kids that were diagnosed with ADD, ADHD, and after 12 weeks, all of their markers. You remember that study I'm talking about?
Yeah, and I think that's what makes and what you're getting, I think that's what makes the SHINE program so incredible, is that they've done studies where they just give kids fish oil, and their ADD symptoms get better.
Yep.
And there's also studies that just give them specific exercises and these kids get better.
Right.
Or there's kids that just get chiropractic
Right.
and they get better.
Sure.
But the Shine program incorporates it all. Their diet, their supplementation, chiropractic, making sure their nervous system is functioning properly,
Sure.
that their posture is better, that they're breathing better, and you get an incredible response that no other program can get.
We can't show the exercises. I want to get into the exercise part of this. But talk about, really quickly, exercising in children. Are we talking about the lack of general overall exercise, or are we talking specific exercises for
I
ADD?
do believe that it's twofold.
Right.
First, too many kids are not being as active.
Sure.
I know that when you were a kid and then when I was a kid,
Yep.
we would be out all day.
Sure.
My dad would, at 9 o'clock at night, would stand on the porch and scream my name to come home, and
Sure.
I'd come running down the block and go
Sure.
home. So there's not enough playtime, too much computer use. But the exercises that we specifically deal with in Shine are more to integrate the brain and to work on strength and core muscle tone and musculature.
Awesome.
So standing on one leg,
Yep.
standing on one leg with your eyes closed,
Sure.
standing on one leg while I ask you to spell your name backwards.
Sure.
Things like that. Doing core exercises like planking, for those of you who know
Sure.
at the gym, or side planks, or Supermans to strengthen the core muscles around your spine. Those types of exercises.
Awesome. Awesome. So we have about a minute left. Is there anything that you'd like to say that you haven't said yet? It has been a pleasure to have you on the show. We will have you back as our #1 guest. Is there anything you'd like to say to the community?
What I'd like to say to the community is if you're more interested about the Shine program, watch and look out for the paper and find out when we're giving a presentation in our office so you can learn more about it. The office is on 734 Broadway. We do the Shine presentation in depth every other month.
Sure.
And if there's any child out there or parent out there that needs help, or adult that needs help, call the office.
Sure.
We'll talk to you anytime and spend time with you, and with no obligation, just to get to know you and show you that we're in it to help you.
Awesome. Well, I want to thank you all for watching tonight. It has been a pleasure to be with you, and we will see you next time. Thanks so much. Bye-bye.
Pretty good.